Hello, welcome to Acharya Nidana Academy. In this particular video, we are going to discuss one of the important topic which is being asked or which is being searched by most of the Ayurveda learners as far as bedside learning is concerned, that is chief complaints. What actually this particular chief complaint refers to? Sometimes it is also being said that it is the presenting complaint, or sometimes it is also being said that the principal complaint. When you say about the principal complaint, that is actually referred as the most troubling discomfort told by the patient whenever he visits the hospital or clinic. Whenever if you say about the discomfort is concerned, there are of two categories: subjective symptoms and objective symptoms. The term subjective symptoms, that is being referred as symptoms itself. So that means the complaints which are perceived by the patient or client. Whereas objective complaints, they are referred as signs which are elicited by the clinicians. In the sense, the person is suffering from headache is considered as symptom, whereas the tenderness observed in the frontal sinus region is termed as sign. Chest pain is considered as symptom. Abnormal breath sound observed by the clinician is termed as signs. Abdominal pain in the epigastric region is termed as symptom. So, eliciting the tenderness on palpation of the epigastric region is termed as sign. As far as recording the presenting complaint, that has to be recorded in patient's own words. Why so own words are necessary? Because of the misinformation which is being what do you say, that the gained even at the rural areas. In some of the occasions, in some of the regions, specifically in the rural areas, some of the village people, they are having the notion that kidneys are absent in females. That means, so they are actually having the notion that the scrotum is considered to be kidneys. This is the one of the misinformation. For that reason, the presenting complaint should be mentioned in patient's own words. And that has to be mentioned along with the duration. So here are some of the few examples we have quoted. So that is patient's own words, such as headache, abdominal pain, cough, breathlessness, or feeling of warmth inside the body. That has to be mentioned along with the duration, since 2 days, like that. So that should not be like that. I am having diabetes mellitus since 5 years. That is not the way to write the chief complaint. Or I am having thyroid problem since 3 years. And I am having hypertension since 2 years. I am suffering from epilepsy since 6 months. I am having myocardial infarction since 1 month, or 1 month back I had myocardial infarction. So this way of writing the chief complaint has to be avoided, because this may be having a different meaning to different people. Another example to say this: cough since 4 days, sneezing since 4 days, running nose since 3 days, nasal blockage since 2 days, inability to perceive the smell since 2 days, pain in the ears since 1 day. If you look into that, most of the symptoms are pertaining to upper respiratory tract. So the route of entry of pathogen we are going to predict is through the nose itself when you are analyzing this particular phenomenon, that is chronological order. So if you are saying running nose since 3 days and cough since 4 days, inability to perceive the smell since 2 days, nasal blockage since 3 days, etc. If you are writing like this, that is not serving the purpose of documenting the chief complaints. That has to be mentioned in the chronological order itself. Some other examples of writing the chief complaint. For example, person is suffering from pain in the chest since 3 months. Difficulty in swallowing the liquids since 2.5 months. Difficulty in swallowing for the solids since 1 month. Expulsion of the food from the mouth immediately after swallowing since 20 days. This is indicative of the progression of the illness as such. The most probable diagnosis in this particular occasion will be the carcinoma of the esophagus. So this is how, the documenting the chief complaints will be helpful in making the clinical diagnosis. For example, another example, pain in the gastric region since 3 days, sore belching since 2 days, burning sensation in the retrosternal region since 2 days. This is very specific of a alimentary canal dysfunction. The 2, upper alimentary canal dysfunction. The 2, stomach and esophageal disturbances, as such we can able to predict here. Or otherwise, hyperacidity syndrome, we can able to make the diagnosis here. So, third example, burning mixture since 3 days, pain in the lower abdomen since 2 days, pain observed in the right flank since 1 day. When you think about this, the most probable diagnosis is favoring towards urinary tract dysfunction or urinary tract infection. Probably the source of infection is urethra. Like this, you have to write in the chronological order itself. To write these different chief complaints or associated complaints in the chronological order, one should know the list of the presenting complaints that are being observed in different systemic dysfunctions. Whenever if you are saying about this, we are having a certain list of the systems: respiratory system, cardiovascular system, alimentary canal or digestive system, musculoskeletal system, nervous system, urinary system, integumentary system, reproductive system, and endocrine system. So these are some of the systems. They are being functioning coherently to maintain the health of the individual. If because of the exposure to any of the etiological factors, either maybe through the nose or mouth or different parts, that is exhibiting the certain set of the symptoms as such. Now we are going to list out these different presenting complaints, which may be the possibility of chief complaints in the patients who are visiting to you in the hospital or in your private clinic. Starting with the respiratory system, the symptoms may be observed in the respiratory system dysfunction are cough, sneezing, running nose, nasal blockage, heaviness of the head, may be specifically seen in paranasal dysfunction, breathlessness. The two, in case of upper respiratory tract dysfunction, it will be inspiratory breathlessness, inability to perceive the smell, pain in the ears, which is attributing to the blockage of the Eustachian tube, post nasal drip, that is movement of the secretions from the nasal cavity into the oropharynx, and hoarseness of voice, which is attributing the abnormal functioning of vocal cords. All these are relating to upper alimentary canal dysfunction, whereas cough, sputum, lateralized chest pain, expiratory breathlessness, hemoptysis, etc., they are attributing the lower respiratory tract dysfunction. There are certain symptoms which are considered as constitutional symptoms. Constitutional symptoms refers to the symptoms which may be observed in any of the systemic dysfunction. They are fever, weight loss, etc. When you speak about the cardiovascular symptoms, the most of the symptoms are that may be breathlessness. Breathlessness will be observed in the form of breathlessness on exertion. That is, while doing the exertion, the person will be, or the exercise, the person will be developing the breathlessness. Paroxysmal nocturnal dyspnea, the breathlessness observed in episodes at night time. That means the person will be having the presence and absence of breathlessness on the alternative cycles. Orthopnea, where the person will be feeling the breathlessness and he has to sit forward for most of the occasions at night time. And chain strokes breathing, that is gradual increase of the depth of the breath as well as absence of breathing. That will be the chain strokes breathing. That is waxing and waning of respiration, that is being said like that. Chest discomfort, usually centralized chest pain. Cough with pink frothy sputum, indicative of left ventricular or left-sided heart dysfunction. Bilateral pedal edema, indicative of right-sided heart failure. Pain in the right hypochondric region, indicating the backflow of the blood from the inferior vena cava into the hepatic veins, thereby liver is going to get enlarged. Loss of appetite, attributing the backflow of the blood from the portal veins into the stomach as well as small intestine. Nausea or vomiting, again this is attributable to backflow of the blood from the portal veins into the alimentary canal. Ascites, so again attributable to portal hypertension. What is being said as cardiac cirrhosis. Oliguria and nocturia, that is attributable to the poor blood supply from the left ventricle to renal arteries, that is oliguria. Whereas nocturia, that is increased urine formation at night time. It is attributable to increased blood supply to the kidneys at night time due to the redistribution of fluid from the redistribution of the pumping of the blood from the left ventricle. Syncopal episode, so that is reduced blood supply to the brain, which is leading to altered consciousness as such, and palpitation. So that is abnormal awareness of one's own breathing pattern. That is, these are the symptoms that may be observed in the person who is having the cardiovascular dysfunction. When you think about a digestive dysfunction, in case of the mouth, the person may have thirst and dryness of mouth, excess salivation, difficulty in swallowing, speaking and chewing, disturbance in relation to taste, and soreness and pain. When the person is having esophageal dysfunction, the person may have dysphagia, pain, regurgitation, and hematemesis. Hematemesis means the vomiting of the blood. As far as stomach and duodenal dysfunction are concerned, the person may have pain in the gastric region, vomiting, hematemesis, and person may have melena, that is dark tarry stew, nausea or vomiting, flatulence, that is the distension of the abdomen, disturbed appetite, heartburn, and sore erectations, which is attributing the more amount of hydrochloric acid secretion. Plus sore erectation in the sense that is relaxation of a lower esophageal sphincter. As far as small intestine, large intestine dysfunction are concerned, the person may have pain abdomen, he may have constipation, diarrhea, tenesmus, bleeding per rectum, and abnormal discharge per annum. These are the symptoms that may be present in cases of digestive tract dysfunction. Plus, when the person is having hepatobiliary dysfunction, he may have pain in the right upper quadrant. That is, the person may have pain in the hypochondric region, right hypochondric region, as well as the person may have pain in the gastric region. Jaundice, that is yellowish discoloration of the skin, mucosa and sclera, and ventral surface of tongue. Fatigue, bleeding per rectum, that is backflow of the blood to the superior mesenteric vein, which is in turn resulting in the internal hemorrhoids to get varicose. Itching, which is attributable to the deposition of bile salts in the skin. Abdominal distension, which is attributing to portal hypertension. All these are indicative of digestive dysfunctions. When you think about musculoskeletal dysfunctions, the person may have pain, which may be present in the joints, which may be observed during the movements, bones, which are considered to be dull, aching type of pain, muscles, ligaments, and tendons, which are very specifically resulting in the movement, that is the pain during the movement. The person may have deformity in the bones or joints. Impaired movement may be observed, cracking sound and creaking sound while moving the joints are being observed in case of musculoskeletal dysfunctions. Neurological symptoms. Higher mental functions. The person may have altered state of consciousness, which may be leading to delirium to coma. Delirium, stupor, semi-coma, and coma. The person may have photophobia. The person may have memory disturbances, such as loss of memory, etc. The person may have behavioral abnormalities, which is attributed to limbic system dysfunctions. Speech defects, maybe dysphagia, dysarthria, and dysphonia. Dysphagia or aphasia, where lesions will be observed in the cerebral cortex or the cerebral hemisphere. Dysarthria or anarthria, where the dysfunctions will be observed in the muscles of articulation of speech. And dysphonia or aphonia, where the lesions are being observed in the vocal cords. As far as cranial dysfunction are concerned, these are the following symptoms that may be observed: abnormal sensation of smell, visual abnormality, diplopia or double vision or squint, difficulty in mastication or loss of sensation on the face, deviation of angle of mouth or facial asymmetry, loss of taste sensation, deafness, tinnitus or vertigo, nasal intonation or regurgitation of the food into the nasal passage from the mouth, hoarseness of voice, wherein the food is from the alimentary canal will be entering into the respiratory passage, and lack of movement of tongue, which is attributable to poor movement of the tongue or the tongue atrophy. All these are the cranial nerve dysfunctions can be seen there. Whereas Motor system symptoms, they are loss of power, muscle weakness or clumsiness of movements, wasting of the muscle or swelling of the muscles are being seen. Fasciculation, that is twitching of the muscle or one group of muscles. Flexor spasms, the person will be having the flexion attitude of the muscle, either maybe in the upper limb or lower limb, or involuntary movements, maybe repeated shrugging of the shoulders, or repeated blinking of the eyes, or repeated involuntary movements, as such, pain in the muscles, and abnormal gait or unsteady gait are mainly attributable to motor system dysfunctions. Whereas sensory system symptoms may be observed are anesthesia, that is total loss of sensation, paresthesia, that is abnormal sensation, maybe either tingling sensation, just as if your ants are moving in the body, and numbness, that is as if you are keeping the eyes on the hands. That is what we are going to observe there. Burning sensation in the palm and soles, or sometimes even in the back also, which may be attributable to the peripheral neuropathies. Analgesia, that is abnormal, that is the loss of pain sensation. Hyperesthesia or hyposthesia, that is increased sense perception or decreased sense perception. Root pain, specifically observed in cases of sciatica syndromes. Certain other symptoms which are attributed to abnormal functioning of the nervous system are headache, vomiting, convulsions, or coma, which may indicate increased intracranial tension. That means maybe in case of brain tumor, or maybe because of the hemorrhage observed in the brain, etc. In case of cerebellar dysfunctions, the person may have vertigo, ataxia, or incoordination. Whereas in case of abnormal autonomic nervous dysfunction, the person may have retention of urine, incontinence, precipitancy or hesitancy, burning micturition. This is specifically seen during catheterization. Impotence, diarrhea or constipation, abnormal sweating, which may be attributable to autonomic nervous dysfunction. Some of the miscellaneous symptoms may be observed are fever, specifically seen in case of meningitis or brain abscess, pain in the neck, seen in case of subarachnoidal hemorrhage or meningitis or cervical spondylosis, history of fall, observed in case of seizure or epilepsy, psychological changes such as depression or sleep disorder, discharge from the ear, seen in cases of meningitis. As far as urinary symptoms are concerned, obstructive symptoms, that is hesitancy, that is the delay in initiation of micturition, poor flow, intermittency, continuous flow of urine during micturition becoming absent, and terminal dribble, seen in the persons who are suffering from benign prostatic hyperplasia or prostatic enlargement. Irritative symptoms observed may be dysuria, that is painful micturition, urgency, that is unable to hold the unable to hold the micturition urge, nocturia, increased urine formation at night time, frequency, increased frequency of micturition. All they are indicative of irritability of urinary system. Incontinence, stress incontinence, such as the appearance of urine, incontinence while coughing, sneezing, etc. Urge incontinence and continuous incontinence. That is, the person will not be having the capacity to hold the urge of micturition. Pain, that is pain radiating from loin to groin. Hematuria, that is the presence of blood, that is RBC or hemoglobin in the urine. And sexual dysfunction may also be observed there, which may be different in case of males as well as females. These we are going to discuss in the next coming slide itself. As far as integumentary symptoms are concerned, they are discomfort, maybe in the form of itching or oozing from the skin lesion. Disfiguration means the deviation from the normal appearance of skin, that is discoloration, etc. Discharge, either it may be reddish color discharge or pus discharge or simple watery discharge, etc. And death in case of severe diseases such as the malignancy of the skin. Plus, the person may have symptoms related to hair, such as patchy hair loss, or nails, such as the pain in the nails and the mucosa of anogenital region. So these are the symptoms that may be observed in case of integumentary system or the affliction. As far as reproductive symptoms are concerned, male reproductive system, the person may have reduced libido or the desire to have sexual intercourse. Erectile dysfunction, the person is not in a position to have the erection properly or maintain the erection properly. That means the person may have performance anxiety and orgasmic dysfunction. That means the person is not in a position to attain orgasm. As far as female reproductive system, the possible symptoms observed may be reduced libido, again, reduced desire to have sexual intercourse, dyspareunia, what is being said to be painful sexual intercourse, orgasmic dysfunction, that is, the females are not in a position to attain orgasm, and menstrual cycle related symptoms may be observed in case of the reproductive systems dysfunction. As far as endocrine system dysfunction, the following symptoms may be the related to body size and shape, that is short stature, that is person may have dwarfism, or tall stature, the person will be having the height more than normal. Weight gain, it's in case of the PCOD, etc., or hypothyroidism, etc. Weight loss in case of hyperthyroidism, or in cases of the uncontrolled diabetes mellitus, etc. As far as metabolic effects, symptoms pertaining to that could be tiredness, weakness, increased or decreased appetite, polydipsia or polyphagia. Polydipsia in the sense increased thirst, polyphagia, that is the person will be having the craving to consume the food, nocturia, increased formation of the urine at night time, tremors, that is the involuntary movements, specifically seen in case of hyperthyroidism, palpitation, and anxiety. They are considered to be metabolic effects related symptoms. As far as some of the local effects, such as swelling in the neck, hyperthyroidism, or the goiter, pain in the hands, may be specifically seen in carpal tunnel syndrome, bone or muscular pain. In case of the what do you say, that the parathyroid gland dysfunctions, protrusion of the eyes, hyperthyroidism, visual loss or headache attributable to pituitary dysfunctions, etc. Reproductive related endocrine system dysfunctions are loss of libido, impotence, oligomenorrhea, galactorrhea, gynecomastia, and delayed puberty or precocious puberty. Delayed puberty in the sense the person is going to attain puberty at a much later time, whereas precocious puberty, where the adolescents will attain the puberty at a very early age. As far as skin related endocrine system symptoms are hirsutism, that is male type of pattern observed in females, hair thinning, pigmentation of the skin, dry skin, and excessive sweating. These are the different endocrine symptoms that can be observed in the individuals when they are visiting to the hospitals. So take-home messages from today's session are: symptoms, they are otherwise called as subjective complaints, which are being perceived by the client or the patient who are visiting to the clinic or hospital. That has to be should be identified, which are the chief complaints as such. These should be written in patient's own words, along with the duration and in the chronological order. We have seen different examples how to write the information in the chronological order and what is the benefit of it. We have seen, and we have also seen different set of symptoms that can be observed in different, or that is systemic dysfunctions. That's all for today. Dear ANA members, so look into this particular video completely and mention in the comment box what are the major key takeaways from today's discussion, and mention what is the one particular video that would you like to have in this particular channel. Mention in the comment box. And if you are liking this particular video, then spread this particular video to maximum number of true Ayurveda learners so that we can make a huge movement out of this particular small message. In my next video, we are going to discuss what may be the possible symptoms in terms of the Ayurveda science. That's all for today. Thank you.